Today we're going to talk about a condition that affects millions of people around the world. It's called Parkinson's disease. You may have heard the name, but what does it really mean? Put simply, Parkinson's is a long-term condition that affects the brain. It gets worse over time, which we in the medical field call progressive. Imagine your brain is like a very busy control center for your body. This control center uses special messengers called chemicals to send signals. These signals tell your muscles when to move, how to balance, and how to coordinate everything you do without even thinking about it. Parkinson's disrupts some of these important messages. The key messenger we need to focus on is a chemical called dopamine. Think of dopamine as the oil that keeps the gears of your movement system running smoothly. In the brain of a person with Parkinson's, certain nerve cells, or neurons, start to break down and die. These are the specific cells that produce dopamine. As these cells are lost, the amount of dopamine in the brain decreases. Without enough of this crucial chemical, the messages from the brain to the muscles become slow, jumbled, or don't get through properly. This communication breakdown is what leads to the symptoms that we associate with the disease. It's important to understand that Parkinson's is not contagious. You can't catch it from another person like you would a cold. The exact cause is still a mystery that scientists are working hard to solve. We believe it's likely a combination of a person's genes and certain factors in their environment. It usually begins to show up in people over the age of 60, but it can sometimes affect younger individuals as well. We call this young-onset Parkinson's. The journey with Parkinson's is different for everyone. No two people will experience it in exactly the same way, which is why personalized care is so vital. So, when we talk about Parkinson's, we are talking about a brain disorder that primarily affects movement. It's a condition where the brain's ability to produce dopamine is reduced. This leads to problems with controlling muscles and motion, but as we will explore, it's also much more than just a movement disorder. It can affect mood, sleep, and even the sense of smell. Understanding this basic foundation is the first step toward appreciating the challenges faced by those living with the condition and the incredible progress we are making in fighting it. It's a complex puzzle, but one we are getting closer to solving every single day. When doctors diagnose Parkinson's, they look for a few key physical signs. These are often called the motor symptoms because they relate to movement. The most well-known of these is the tremor. This is an involuntary shaking that usually starts in one limb, often a hand or fingers, when the person is at rest. You might see a person's thumb and forefinger rubbing together in a motion we call a pill-rolling tremor. This shaking often goes away when they start to move or use that hand for a task. While it's the symptom most people associate with Parkinson's, it's important to know that not everyone with the disease will experience a significant tremor. Another major symptom is called bradykinesia, which is a medical term for slowness of movement. This can be one of the most frustrating aspects of the disease. Simple everyday tasks can suddenly take much longer to complete. Getting dressed, cutting food, or even just getting up from a chair can become a slow and deliberate process. This slowness can also affect a person's facial expressions, leading to what is sometimes called a Parkinson's mask. Their face may look serious or flat, not because they are unhappy, but because the muscles that create expressions have become slower and less responsive. Next, we have rigidity, or stiffness in the muscles. A person with Parkinson's might feel like their muscles are tight and won't relax, even when they aren't trying to move. This can happen in the arms, legs, or the trunk of the body. A doctor might feel this stiffness when moving a patient's arm or leg. This rigidity can limit the range of motion and often causes muscle aches and pain. It can make fluid movements like swinging your arms when you walk very difficult. This stiffness, combined with the slowness, contributes significantly to the challenges of daily activities and can be a source of constant discomfort for the individual. Finally, there is postural instability, which means problems with balance and coordination. This symptom usually appears later in the course of the disease. A person might start to stoop or hunch forward. They may have trouble making quick turns or may feel unsteady on their feet, which increases the risk of falling. This loss of automatic balance reflexes means they have to consciously think about staying upright. To Together, these four symptoms, tremor, slowness of movement, rigidity, and postural instability, form the classic picture of Parkinson's disease, creating a unique set of physical hurdles for each person to navigate. While the movement-related symptoms are the most visible signs of Parkinson's, the disease has a wide range of effects that go beyond what we can see. These are called non-motor symptoms, and for many people they can be just as challenging, if not more so, than the physical ones. For example, many individuals with Parkinson's experience significant changes in their mood. Depression and anxiety are very common. It's not just a psychological reaction to having a chronic illness. It's also caused by the same chemical changes in the brain that affect movement. The loss of dopamine and other brain chemicals like serotonin can directly impact a person's emotional well-being. Another common non-motor symptom involves what we call autonomic functions, the things your body does automatically. This can include problems with blood pressure, leading to dizziness or lightheadedness when standing up. Many people also struggle with constipation because the digestive system slows down. Excessive sweating, problems with urinary control, and sexual dysfunction are also part of this picture. These are deeply personal and often uncomfortable issues to talk about, but they are a very real part of the Parkinson's experience and have a major impact on a person's quality of life. It's crucial that patients feel they can discuss these issues openly with their doctors. Cognitive changes can also occur. This doesn't mean everyone with Parkinson's will develop dementia, but many experience issues with what we call executive function. This is the brain's ability to plan, multitask, and solve problems. A person might find it difficult to organize their thoughts or to focus on a task for a long period. They might have trouble finding the right words when they speak. Memory problems can also arise, particularly with recalling recent events. These cognitive shifts can be subtle at first, but can become more pronounced over time, making work and complex social interactions more difficult. Finally, sleep disorders and fatigue are almost universal among people with Parkinson's. Many struggle with insomnia, finding it hard to fall asleep or stay asleep through the night. Restless leg syndrome, where a person has an irresistible urge to move their legs, is also common. Some may even act out their dreams vividly, a condition known as REM sleep behavior disorder. All of this leads to profound fatigue during the day, a deep, draining exhaustion that isn't relieved by rest. This fatigue, combined with the other non-motor symptoms, shows that Parkinson's is truly a whole-body disease, affecting nearly every aspect of a person's being. Imagine waking up in the morning. For many of us, getting out of bed is an automatic process. For someone with Parkinson's, it can be the first major challenge of the day. The muscle stiffness or rigidity can make their body feel trapped and heavy. Turning over and swinging their legs to the floor requires immense effort and concentration. Then comes the simple act of standing up. The slowness of movement, or bradykinesia, means this action is not swift but a careful, multi-step process. Morning is often a time when medications from the night have worn off, making these symptoms particularly strong and turning the start of the day into a significant hurdle. Once out of bed, the daily routines we take for granted become a series of complex tasks. Think about getting dressed. Buttoning a shirt or pulling on a pair of pants requires fine motor skills that are compromised by tremors and rigidity. Using a toothbrush or shaving can be a slow, painstaking process. Then there's breakfast. Cutting toast or holding a cup of coffee steady can be difficult. The slowness of movement can also affect chewing and swallowing, which means meals take longer and require more focus to avoid choking. Every single one of these small, seemingly simple activities is now a task that demands careful planning and execution. Leaving the house presents a new set of obstacles. Walking can be affected by a shuffled gait, where the feet stay close to the ground, increasing the risk of tripping. Some people experience freezing, a temporary, involuntary inability to move. This can happen unexpectedly, perhaps when trying to walk through a doorway or when stepping off a curb. It feels as though your feet are suddenly glued to the floor. This unpredictability can make a person feel anxious about going out in public. It affects their confidence and can lead to social isolation, as they may start to avoid situations where they might freeze or fall. Throughout the day, a person with Parkinson's must manage their energy and their medications with precision. The fatigue can be overwhelming, requiring scheduled rest periods. Medications need to be taken on a strict schedule to keep symptoms under control. If a dose is late, even by a little bit, symptoms can return, a phenomenon known as an off period. This means their entire day is structured around their medication timing and their fluctuating symptoms. Life is no longer spontaneous. It becomes a carefully managed balancing act between the desire to live fully and the constant demands of the condition. The path to a Parkinson's diagnosis is often not a straight line. There isn't a single definitive test like a blood test or a simple scan that can say with 100% certainty, this is Parkinson's disease. Instead, the diagnosis is primarily clinical. This means it relies on a doctor's expertise in observing the patient's symptoms and taking a detailed medical history. The journey usually begins when a person or their family notices subtle changes. Maybe it's a slight tremor in a finger, a change in handwriting that has become small and cramped, or a softer voice. It could also be a feeling of stiffness, or just a general slowness that they can't quite explain. When a person brings these concerns to a doctor, usually a general practitioner first, they will be asked many questions about their symptoms. When did they start? Does anything make them better or worse? The doctor will then perform a physical examination, looking for the key motor signs we discussed earlier: tremor at rest, rigidity, slowness, and balance issues. They might ask the patient to walk down the hall, tap their fingers and toes, or write a sentence. They're looking for the characteristic patterns of movement that suggest Parkinson's. This initial assessment is a crucial first step in piecing together the diagnostic puzzle. To rule out other conditions that can cause similar symptoms, a doctor will often order further tests. For example, conditions like essential tremor, stroke, or normal pressure hydrocephalus can mimic Parkinson's. So, brain scans such as an MRI or a CT scan might be used. These scans don't show Parkinson's disease itself, but they can help eliminate other possibilities. In some cases, a specialized brain imaging test called a DAT scan may be used. This scan can visualize the dopamine system in the brain and show if there is a reduction in dopamine-producing cells, which is a hallmark of Parkinson's. Often the diagnosis is confirmed by observing how the person responds to Parkinson's medication. A neurologist, a doctor who specializes in the brain and nervous system, will typically prescribe a medication called levodopa. This drug gets converted into dopamine in the brain. If a patient shows a clear and significant improvement in their motor symptoms after taking levodopa, it strongly supports a diagnosis of Parkinson's disease. This levodopa challenge can provide the most certainty in the early stages. Receiving this diagnosis can be a difficult and emotional moment, but it is also the critical turning point that opens the door to treatment, management, and support. While there is currently no cure for Parkinson's disease, we have a growing number of treatments that can effectively manage the symptoms and significantly improve a person's quality of life. The cornerstone of treatment is medication. The most powerful and widely used drug is levodopa, which we mentioned earlier. It is combined with another drug called carbidopa, which helps it work more effectively and reduces side effects like nausea. This medication directly addresses the root of the motor symptoms by replenishing the brain's supply of dopamine. For many people, levodopa can feel like a miracle drug, especially in the early years, dramatically reducing tremor, stiffness, and slowness. Over time, however, the effectiveness of levodopa can fluctuate. A person might experience on-off periods where the medication works well for a while, what we call on time, and then wears off, causing symptoms to return or off time. To manage this, doctors have many other types of medications they can use. These include dopamine agonists, which mimic the effects of dopamine in the brain, and MAO-B inhibitors, which help to prevent the breakdown of the dopamine that is already there. The goal is to create a medication regimen that provides the smoothest, most consistent symptom control throughout the day for as long as possible. When medications are no longer providing adequate control, or if a person develops severe motor fluctuations, a surgical procedure called deep brain stimulation, or DBS, may be an option. This is not a cure, but it can be a life-changing treatment. In DBS, a surgeon implants very thin wires, called electrodes, into specific areas of the brain that control movement. These electrodes are connected to a small, pacemaker-like device implanted in the chest. The device sends continuous electrical pulses to the brain, which helps to block the abnormal signals that cause the motor symptoms. DBS can help reduce tremor, stiffness, and slowness, and decrease the amount of medication a person needs. Beyond medication and surgery, a holistic approach to care is essential. This includes various forms of therapy that are just as important as the medicine. Physical therapy helps with balance, flexibility, and strength. Occupational therapy helps people find new ways to perform daily tasks, like getting dressed or cooking. Speech therapy can help with voice volume and swallowing difficulties. Exercise is also incredibly important. Research has shown that regular, vigorous exercise, such as boxing, dancing, or cycling, can actually help slow the progression of the disease. Managing Parkinson's is a team effort, combining medical treatments with therapies and lifestyle changes. Real stories often tell us more than medical textbooks ever could. Let's think about a man named David, a 62-year-old retired teacher who was diagnosed with Parkinson's 5 years ago. His first sign was a tremor in his left hand, which made his beloved hobby of woodworking difficult. At first, the diagnosis left him feeling defeated. He worried he would have to give up everything he loved, but David decided to fight back. He started a rigorous exercise program, joining a rock-steady boxing class specifically designed for people with Parkinson's. He found that the high-intensity, non-contact boxing drills improved his balance and coordination more than he ever imagined. David's story shows us that a diagnosis is not an ending. He had to adapt, certainly. He now uses special tools with thicker handles in his workshop to compensate for his tremor. He admits there are bad days when the fatigue is overwhelming and his movements are slow. But on good days, he is in his workshop, creating beautiful pieces of furniture. He says the key is to focus on what he can do, not what he can't. He has become an advocate in his community, speaking to newly diagnosed patients and sharing his experience. He shows them that it is possible to live a full and meaningful life with the condition, finding new strengths along the way. Then there is the story of Sarah, who was diagnosed with young-onset Parkinson's at the age of 45. As a busy lawyer and mother of 2 teenagers, her biggest challenge was not the tremor, but the non-motor symptoms, crippling fatigue and brain fog, that made her demanding job feel impossible. She worried about how her condition would affect her family and her career. Sarah worked closely with her neurologist and an occupational therapist to develop strategies. She learned to break down complex legal documents into smaller, manageable chunks. She started using voice-to-text software to help with writing and scheduled short rest periods throughout her workday. Sarah's journey highlights the importance of adaptation and self-advocacy. She had to be open with her colleagues about her condition, which was difficult at first, but ultimately led to a more supportive work environment. She also discovered the power of mindfulness and meditation to help manage her anxiety. Her story is one of incredible resilience. She continues to practice law, though she has adjusted her workload. She has learned to listen to her body and to prioritize her well-being. Sarah's experience teaches us that Parkinson's forces you to redefine success and find a new, more sustainable rhythm for life, proving that strength comes in many forms. No one should have to face a Parkinson's diagnosis alone. The journey is made immeasurably easier with a strong support system. This support comes in many forms, starting with family and friends. For the person diagnosed, having loved ones who are patient, understanding, and willing to learn about the condition is invaluable. It's about more than just physical help. It's about emotional connection. It's having someone who understands that a masked face doesn't mean a lack of emotion, or that a sudden need to cancel plans is due to overwhelming fatigue, not a lack of interest. This emotional foundation is crucial for maintaining a positive outlook. The role of the caregiver is one of the most important and demanding in the Parkinson's journey. Often this role falls to a spouse, partner, or adult child. Caregivers become experts in medication schedules, doctor's appointments, and symptom management. They provide physical assistance with daily tasks and offer constant emotional encouragement. However, this role can take a significant toll. Caregiver burnout is a very real and serious issue. It is vital for caregivers to seek support for themselves, to take breaks, and to maintain their own health and well-being. They cannot pour from an empty cup, and their health is just as important in the long-term management of the disease. Beyond the immediate family, connecting with a wider community can be a game-changer. Support groups, both in person and online, offer a unique space where people with Parkinson's and their families can connect with others who truly understand what they are going through. In these groups, people can share practical tips for managing symptoms, vent their frustrations without judgment, and celebrate small victories. Hearing from others who are navigating similar challenges can reduce feelings of isolation and provide a powerful sense of belonging. It's a place to learn, to share, and to be reminded that you are part of a large and resilient community. Professional support from a multidisciplinary healthcare team is the final essential piece of the puzzle. This team often includes a neurologist, a physical therapist, an occupational therapist, a speech therapist, a social worker, and a nutritionist. Each professional brings their specialized knowledge to create a comprehensive care plan that addresses the whole person, not just the disease. This team-based approach ensures that all aspects of the condition, motor, non-motor, emotional, and social, are being managed. This network of family, community, and professional support creates a safety net that empowers people to live their best possible lives with Parkinson's. As we look to the future, there is tremendous reason for hope in the world of Parkinson's disease. The pace of scientific research has never been faster. Scientists around the globe are working tirelessly to unravel the complex mysteries of the disease, and their efforts are leading to exciting breakthroughs. One of the most promising areas of research is genetics. By identifying specific genes linked to an increased risk of Parkinson's, researchers are gaining powerful new insights into the underlying causes of the disease. This genetic knowledge is paving the way for the development of highly targeted therapies that could one day slow or even stop the disease's progression. Another major focus is the search for biomarkers. Remember how we said there is no simple test for Parkinson's? Researchers are working to change that. They are looking for reliable biomarkers, substances or signals in the blood, spinal fluid, or even the skin that can indicate the presence of the disease, ideally long before the major motor symptoms appear. An early diagnosis would be a monumental achievement. It would allow doctors to start protective treatment sooner, potentially preserving brain function and giving people more years of high-quality life. This is one of the holy grails of Parkinson's research. In terms of new treatments, the pipeline is full of innovative ideas. Scientists are exploring therapies that go beyond just replacing dopamine. They are developing drugs designed to protect neurons from dying in the first place. They are also investigating ways to clear out the toxic protein clumps, called Lewy bodies, that build up in the brains of people with Parkinson's. Furthermore, regenerative medicine, including stem cell therapy, holds the potential to one day repair and replace the damaged dopamine-producing cells. While these advanced therapies are still in development, they represent a future where we might not just manage symptoms, but truly alter the course of the disease. The future is not just about a cure, it's also about improving life for people living with Parkinson's right now. Advances in technology are leading to wearable sensors that can monitor symptoms in real time, helping doctors to fine-tune medication schedules with incredible precision. New exercise programs and therapy techniques are constantly being developed to better manage symptoms. The global Parkinson's community is more connected and empowered than ever before. There is a powerful collective momentum driving us forward. While the challenges are real, the progress is undeniable. The horizon is bright, and it is filled with hope.